them. If not, you can do that. You can do that today and have a look at more details regarding the session. So some details we can't actually cover, so they're best covered um, by reading more material, which is recommended for this unit. Um, this is our second session. It won't be very long because we've covered almost everything in the first session. Um, it's understanding the changes in medicine that brought about today's concept of the doctors know best approach. So yesterday we had talked about what it meant by when we said the patient knows best. So it was putting the patients at the center of everything, making it a person-centered approach where there's empathy, where there's acknowledging their own needs, where there's independence of decision making, where there's flexibility for the patient. So that was put into focus, and there was collaboration between the patients and their um, uh, um, their own loved ones, and between different workforces. So, and it is a holistic approach where prevention, rehabilitation, primary, secondary care, all of it comes into play, and all of it is patient centered. Now we're talking about doctors know best. Um, so there's a bit of videos that I would want to show you. So again, in this you have indicative content where we will assess you in the assessment for your understanding of the subject, your application of knowledge, use of the information, communication, and your presentation, and your quality of work. There's a great descriptor on each of these, related to each of these. Please have a look at it in your on your Moodle page. Just a bit about yesterday. It's what is medicine. So we're talking about changes that took place in medicine and health. So medicine is the science and practice of caring for people, for patients actually, managing their diagnosis, prognosis, prevention, treatment, palliation of their injury or disease. So that means making it better, and promoting their health. So this was discussed in detail yesterday. And what is health? So we talked about health. It's the state. It's according to the World Health Organization. It is a state of complete physical, mental, social well-being, and it is not only the absence of disease and infirmity. Okay, and then a resource of for everyday life, not the objective of living. So now, the only objective would not be just to live a life. It is living a healthy life. Health is a positive concept which emphasizes on social and personal resources as well as physical capacities, according to World Health Organization again. Louis Pasteur, the few father of immunology, we've discussed this already. So Louis Pasteur was the first one to discover the germ, and under the microscope, he suggested that germs are responsible. They work as seeds, and they're responsible for um, carrying out for making you ill, and then transmitting that disease, making it contagious. Joseph Lister, a bit about him. So we'll look at a video that will give you a full understanding of. Let me know once this video is visible to you. Just a I just wanted to know if you can you hear this video? Is it audible to you?
I cannot, I'm having problems. Anyone there? Can anyone hear this video? Is this video audible to anyone? If anyone of you could answer me, please. So I am not sure if it's audible or not. Is everyone there in the meeting?
Hello.
Yeah, can you hear this video?
No, it's only your voice that I can hear.
Yeah, I don't think it's audible to me as well. I'll just stop sharing it. Just a minute, I'll start sharing it again.
This is audible. Just a minute. I'll do one more thing. I'll stop sharing this. Just bear with me for a minute. It's just yeah, I'll share with you another link if that's audible. Please let me know. I don't have an idea why this sound isn't. Why doesn't it have sound? Anyways, just one more setting. So
Don't think this is audible at the moment. What I can do is I can just share the link with you, so you can have a look at this, and it should be audible to you, because if I'm audible to you and this video isn't, then there's something. Yeah, can you hear
Me. Yeah, I'll just start sharing my slides again and we'll talk about it instead of this was just an addition that I wanted to share with you, so it's okay. I'll share the link with you and you can have a look at it right after the session is over. I'm not sure what's happened to my sound. So just have a look at this video as soon as you're done with this session. So I'm putting it in the chat box here. So before you leave, I'll just leave you to watch this video. Okay, so it is about what role each individual had with regards to health and disease. So you'll see a bit about what the history of medicine was about and how did changes occur, what diseases brought about changes, and then there's misery to mirth, there's recovery from illness in modern England. How did that happen? So this video actually shows you, gives you a lot of information there. There's some reading articles which will talk about how the invention of key medical implementation and machines, how did they advance medicine. So there's some reading articles on your Moodle page where you can have a look at advancing nuclear medicine through innovation. Just have a look at this, and I'll share the link also with you now. It's 15 medical inventions and discoveries from the 1800s that have come to define modern medicine. Have a look at this. And artificial intelligence, AI, for health and healthcare. So we'll talk a bit about this now. Just share. Okay, so um, the uh, the bit here talks about analyzing how advances um, in medicine have led to the domain of the doctor knows best, and how has this improved the relationship between um, the doctor and the patient. So there are three advances in health and medicine. Uh, there there are many advances actually, but some of the most renowned ones have been vaccines. It has been anesthesia and medical imaging, and some drugs such as penicillin. They've made remarkable improvements in health. So vaccines, they were introduced in 1796. They're still used up till now, and their methods, they are a way of preventing illnesses. Instead of curing them, they're preventing illnesses. And yesterday we had a long discussion on how prevention is always better than cure. Anesthesia, so if there was no anesthesia, obviously you could not cure patients, you could not treat patients, you could not conduct surgeries. So this is why anesthesia is so important. And medical imaging, obviously, for every condition, almost every condition, you need medical imaging, you need X-ray technology. So if that wasn't coming, that did not come in 1895, there would be very slight chances that medicine could have been the way it is now. And penicillin in 1928 to treat certain illnesses, especially it's an antibiotic to treat certain bacteria. And some people may be resistant to penicillin, or they may have allergies to penicillin, so you have other medication for them. Um, some modern day advances are epidemiology. So epidemiology is studying how the disease how it happens, the time, place, and person where diseases happen. The germ theory we've talked about epidemiology. It is about the disease, how it happens, in which populations it happens, their ages, their the gender, the race, the ethnicity. Why does it happen, and why does it not happen in other places? That all talks about epidemiology. So that has supported a lot in understanding how disease happens and how it is transmitted and how to prevent that disease from occurring. The germ theory talked about basically how germs or so this talks about the germs that were introduced, that were there, and we did not know what was causing illness. So the germ theory actually talks about how illness is caused, or how was it caused, and how was it transmitted from one person to another. And it talks about basically, when it talks about this, it talks about how to prevent disease as well, to prevent the germs from being transmitted from one person to another. Then insulin was introduced, which caused, like there was diabetes, people were dying because of diabetes. But once insulin was introduced, this rates of deaths were decreased drastically, because you could have control on of the complications. So there were no more complications because of diabetes. Gene therapy is another revolution that has been there in place, and it supports some diseases that it actually supports in preventing certain genetically transmitted diseases. And you could then alter genes so that those diseases are not transmitted to next generations. And then there's 3D printing, which obviously is another form where you have three-dimensional or even 4D printing now, in which you have actually it's now you don't need to go through into cutting people and dissecting people to understand that their AI technology. And there's a lot of, I don't know if you've seen them, they're anatomage tables where you can actually have the entire anatomy of the individual. So that's 3D prints, and then you could actually see what's inside the body instead of cutting apart the person to see that, which was done many, many years ago. It's still done now. Some medical professions, they need that. So some things are in place still, and they need to be in place for a reason. Then there's a reading of this paper, Continuity of Care and Patient Experience. Please have a look at this paper as well. These are some of the references. So that's about this session. Again, next week, we will be talking about weekend, Saturday, we will be talking about your assignment. Okay, just bear with me while I'll stop this recording. Do you have any questions? If you have any questions, please feel free to ask them now. Otherwise, you can always send your queries or your questions to learner work, so that wouldn't be a problem. And we can